Psychiatrists, $220,430. While all psychiatrists help treat mental health issues, it's a field with a vast range of specialties. Some work on child and adolescent psychiatry, for example, while others specialize in forensic psychiatry, addiction psychiatry, or consultation psychiatry, which occurs in a medical setting. Others specialize in psychoanalysis, where the psychiatrist helps the patient remember and examine past events and emotions to better understand their current feelings. Psychiatrists can be found in any number of work environments: private practice, hospitals, community agencies, schools, rehabilitation programs, and even prisons. Unlike psychologists, who also treat mental health issues, psychiatrists are medical doctors. After receiving an undergraduate degree, they have to complete medical school, followed by a residency program. According to the American Psychiatric Association, the first year of residency typically involves working in a hospital setting and managing a variety of medical conditions, followed by 3 or more years focused on mental health. Job outlook: among physicians, psychiatry is expected to be one of the fastest growing specialties over the next several years. The BLS predicts that employment will grow 12% from 2019 to 2029. Prosthodontists, $220,840. Prosthodontists fix damaged teeth or missing teeth with artificial devices such as dental implants, dentures, bridges, crowns, and veneers. It's a pretty exclusive club. There are only about 600 prosthodontists in the US. According to the BLS, physicians who thrive in this specialty have a strong inclination toward science, are able to diagnose complex dental problems, and possess the mechanical acumen to properly address ailments. A career in prosthodontics requires a college degree, followed by completion of a dental school program, where they become either a doctor of dental surgery or a doctor of dental medicine. Candidates follow that up with a residency program and ultimately apply for certification from the American Board of Prosthodontics. Job outlook: the number of prosthodontists is expected to stay flat over the next decade, according to BLS projections. Orthodontists, $230,830. Orthodontists specialize in corrective measures for the teeth. These doctors frequently take X-rays, apply braces, create mouth guards, and perform other procedures as needed. High-achieving orthodontists require strong analytical and problem-solving abilities. After earning a college degree, future orthodontists need to complete a dental school program that involves classroom and clinical experience. These newly minted doctors must then complete a specialized residency program and sit for a licensing exam. Job outlook: by 2029, the BLS expects the number of orthodontic jobs in the U.S. to reach 7,300, reflecting a 2% increase from 2019. Obstetricians, gynecologists, $233,610. Doctors specializing in vaginal, ovarian, uterine, and cervical reproductive health and childbirth make slightly below the annual wages listed for oral and maxillofacial surgeons. Successful OB/GYNs are good at communicating information to patients that improve their health and that of their babies. They also excel at handling high-stress situations, most notably childbirths, that can occur at odd hours of the day. Becoming an OB/GYN requires graduation from medical school as well as the completion of an obstetrics program and a gynecology residency program, which typically last 4 years. Afterward, These physicians have to pass a licensure exam before they begin to practice. Job outlook: the number of OB/GYN jobs is expected to decrease by 1% by 2029, according to the BLS. Oral and maxillofacial surgeons, $237,570. Oral and maxillofacial surgeons treat a wide range of diseases, injuries, and defects in and around the mouth and jaw. Among the more common problems they're likely to manage are problematic wisdom teeth, misaligned jaws, tumors, and cysts of the jaw and mouth. They may also perform dental implant surgery. Education: typically, oral and maxillofacial surgeons require an undergraduate degree, a 4-year dental degree, and at least 4 years of residency. After their training, surgeons often take a 2-part exam to become certified in the United States by the American Board of Oral and Maxillofacial Surgery. Job outlook: from 2019 to 2029, employment is expected to increase just 2%, according to the BLS. Surgeons, $252,040. These physicians are rewarded with one of the highest paying careers. Surgeons may find themselves working long, irregular hours, depending on their specialty. While those focusing on preventative and elective surgeries may have a more predictable schedule, surgeons working in fields such as trauma or neurosurgery often work extended, even overnight, shifts. Surgeons help manage the patient's care before and after surgery, even when they're not scheduled for work. Becoming a surgeon requires the successful completion of medical school, a multi-year residency program, and sometimes a specialized fellowship. 10. Job outlook: overall, employment is projected to decline 2% over the next decade, according to the BLS. Anesthesiologists, $261,730. The BLS defines anesthesiologists as physicians who administer anesthetics and analgesics for pain management prior to, during, or after surgery. Work hours for an anesthesiologist follow the schedule of the operating room, which can be long and unpredictable. That's because anesthesiologists need to be there for both scheduled surgeries and emergency procedures, such as trauma events and childbirth. Following 4 years of medical school, typically complete a 4-year residency in anesthesiology and possibly even more, depending on the subspecialty. Job outlook: overall, employment is expected to remain flat over the next decade,